Youth mental health has gotten increased attention in New York in recent years, with the result being more state funding and an emphasis on innovative solutions. But for kids with some of the most severe challenges, it has been business as usual in institutional settings, which can result in lackluster results and sometimes dangerous conditions for staff, as highlighted in recent reporting by the Syracuse Post-Standard. For more on the status quo, we're joined in the Capitol Press Room by Bill Gettman, CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping more than 18,000 kids and adults navigate abuse, mental health needs, and a range of other demands. Thanks for making the time, Bill.
Great to be here, David.
So you recently flagged for me a story out of central New York at a children's hospital where a 12-year-old knocked out a nurse, and you wrote an op-ed in response to the reporting that argued that this was kind of emblematic of a crisis in New York's psychiatric care system, which you added is not new. Can you elaborate on the problems that you see, particularly with hospital placements?
Sure, David. Appreciate the opportunity to highlight this issue because it is a hidden secret. It's a dirty secret. Any night across New York State, there's 100 to 125 kids who are stuck in hospitals, kids who are often ready for medical discharge but have no place to go. So on top of that, you've got kids who've got behavior problems, who have mental health problems, perhaps intellectual disability issues, but also have behavior issues that require a more safe and secure setting for them. The hospital is not the place to do that. There are reports across the state, beyond just Syracuse, that young people do assault medical professionals because they have needs of mental health, but also the needs to be out of the hospital. Hospitals are not the place to treat kids, especially when they're ready and cleared medically.
Well, yeah, that was my question. Is the setting the problem, or is it a resources problem at those facilities?
It's the setting is clearly a problem. First off, kids don't do well in hospitals. Hospitals do short-term acute care and surgery and some of the other procedures. Once they're cleared medically, they need to step down to another setting. Those settings are there's not enough of them, especially for the small cohort of kids who have behavioral needs that need safe settings, secure settings for short terms.
And why aren't there enough of them? Is this an issue where there's just not enough funding? It's a staffing issue? What's the problem?
All roads lead to workforce, as we've often talked about. But beyond that, we need the state agencies to double down on new models, new methods of treating kids short term. Some of that's a capital request for resources. Some of it's a workforce. How do we get nurses, psychiatric nurse practitioners, clinicians, et cetera, into settings and support them with decent rates?
Are there always, though, going to be some kids whose behavioral health problems are so severe that they're going to need to be kept in hospital settings or potentially even secured hospital settings because of the risk of injury to themselves and others? There
are secure settings, forensic settings for kids with severe mental health needs. Some are state operated, but that's a small number. Some of the kids that were highlighted in the Syracuse story were kids where they were just too long, and their parents didn't have the resources, or they did not come to take the kid home to take care of them. And so we need a step-down process here that says, okay, child's ready for discharge. They have severe needs. Where do we place them till we get mom or dad or the grandfather ready to take care of them?
And what about avoiding hospital placements to begin with? Is that something that we should be focusing on, or are hospitals a important part of this overall dynamic and they can serve a meaningful short-term purpose?
So the sad story is when families can't get access to treatment, their kid or child was suspended from school and they're at home schooling, which we know is not really effective, or there's no resources in the community. What often happens is they call 911, they call the police, and the police in an ambulance takes the kid to the hospital because that's the only resource in the community. That's just wrong in some cases. Hospitals should treat, stabilize, and discharge quickly. The other thing we've done is we said there's no resources in the community for your child, so we're going to push you through a probation or juvenile justice lens and get you placed in a secure detention facility or a place like that. Again, the systems are all out of balance and out of whack. We're pushing kids to where there might be beds, even though they don't belong in, for instance, the juvenile justice system. It's a tragedy that we're pushing kids because we don't have access to services.
Well, the backdrop for this conversation is a recent settlement that had to do with kids on Medicaid and ensuring that they were accessing community mental health services. How does that settlement, which is in the process of a multi-year implementation, factor into the conversation we're having?
So the CK versus McDonald and Sullivan settlement with the federal court documented clearly the need for expansion of services, better rates, easier access. There's an 18-month planning process, and then there's a one-year implementation process. We'll be in 2029. We'll be talking about the next Olympics before we get anything off the ground. We need to accelerate that process. We need to invest in rates right now, and we have to stop this kind of one-by-one, step-by-step process. It's a crisis. I will say that the governor's investments have helped on the front end, but we need more of those on the basic mental health programs.
Well, is there anything in this budget, as opposed to maybe past budgets, that would suggest that New York is taking steps to keep kids out of hospitals, whether that means avoiding them or getting them into transitional facilities, and just that broader community investment? There's
two things that the governor has done. The Youth Act program, assertive community treatment, was funded as part of the governor's $1 billion. There's not enough of them, though. Mm-hmm. The need for mental health is going up at the same time that the investment in resources isn't keeping up with them. So it's hard to criticize the governor because she's put some money into it. However, there are other programs that we need to accelerate. For instance, what we call our hospital-to-home program is a discharge program when kids are ready for discharge from hospital, but families aren't ready to take them. We can step them down to a residential setting, non-secure, for up to 120 days till the family's ready to take them on. There are 10 of those programs in New York. Only one has been started up. We need to accelerate. The word is accelerate and invest.
Is your take on this situation unique? Is this contrary to what state agency officials think is the right approach? Where do you stand among your peers?
I think it's safe to say that people on the ground have a much more in-touch perspective on what's going on between placement agencies, hospitals, and families right now. I think we need to stop planning and start looking at the cases and finding solutions to them. I think there's a disconnect, quite frankly.
Are there any lawmakers that are engaged on this?
I mean, the mental health chairs are engaged on this, and certainly the children and family chairs in the assembly and are actively engaged in how to solve the needs for kids who are they're cross systems. They might need OMH services, they might need OPWDD services, and they might need child welfare services. It's so easy for the systems to say, this isn't my problem, that's an OMH problem, or that's an OPW problem, or that's a child welfare problem. We need to get together and say, they're just kids. They have mental health needs, intellectual disability needs, or prevention needs. Let's get to the table and figure out how to build models that work and do it quickly.
That ownership issue, is that a new phenomenon, or has that always plagued the system from your perspective?
Quite frankly, it goes back to the Council on Children and Families, which was under the first Governor Cuomo, who established it back then. It's a leadership issue. We need the governor's office to get the state agencies in the room and create a plan to get there.
Does the consolidation of agencies or the restructuring of agencies potentially offer any sort of relief to that type of question? Or is that one of those things that we just float around every couple of years before then we talk about the inverse and breaking the agencies up?
I think any consolidation is a nice vision, but let's do something now. We'll spend a lot of time looking at regulations and org charts if we think that's the answer.
And from the staff perspective, you've done some stuff about the idea of abuse and neglect and what might cause that. And we're talking about, in some cases, that 100 or so kids who have severely severe issues and are unbelievably hard to deal with on a day-to-day basis. Does that exacerbate the potential for abuse and neglect in facilities based on the status quo?
That's a really good question. I think that could happen, especially if there's not enough trained staff or there's not enough people, going back to the Syracuse story, where they didn't have security in the units. I think you have to have security and people trained in that. That could lead to neglect or abuse. On the community level, I don't think so. Mm-hmm. I think these are just hard kids that have needs, and we have to treat their needs in a safe way. If we can keep them safe, then we can deal with their trauma.
Do people ever balk at the idea that my kid or any kids need to be in a quote-unquote secured facility with some security, for example?
I think the state agencies balk more than families do.
How come?
I think they're afraid of the perception that we're locking kids up for their mental health issues, and that's not what we're saying. We're saying there's a small cohort of kids that need to be safe first. If you've got a mental health issue or a medical condition, but I can't keep you safe, then you're going to have more negative outcomes. I think the other concern here, too, is that we've got a situation where families are at wit's ends. They'll call police or 911. The child will be admitted to the hospital short term, and then when the time comes for discharge, some families don't pick up their kids because they have no resources. So that's why they sit or they board in the hospital, because families don't know what to do. And then you get Child Protective involved, and then the system just becomes contorted.
Is this an area where there's a very disparate experience and outcomes depending on the resources a family has access to? Is a kid on Medicaid going to have a very different experience than a kid with either commercial insurance or deep-pocketed parents?
There is a correlation between poverty and emergency room admissions or emergency room visits. In poorer areas, that's where people go to get their primary care. If you have private or commercial insurance, you'll have other resources, and private facilities can care for your child.
And is the experience in New York, is everything we just talked about unique to New York and how we set things up, or is this a problem in other states as well?
This is a nationwide problem. There's a set of kids who have some very severe needs. I think other states are a little more creative about the residential settings they can provide for these kids, but New York needs to take a bold step.
Is there any challenge in setting these up in communities, or is this one of those NIMBYism issues potentially?
No, I think the opposite is true. I think communities want to see services for their kids. The local community mental health advocates and the local community health commissioners, they throw up their hands on Friday afternoon and say, where do I place this child absent the hospital?
But you don't find that the neighbors of one of these facilities say, oh, that's the house where the kids are screaming sometimes at midnight, or there's always cars coming and going of staff. I mean, is that not a concern?
That occasionally is a concern, but if you work with your community and say this is for the better good for everybody, that problem can be solved.
Well, we've been speaking with Bill Gettman. He's the CEO of Northern Rivers Family of Services, a Capital Region nonprofit helping more than 18,000 kids and adults. Bill, thanks for visiting us. Really appreciate it.
Always great to be here. Have a great spring.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.